Polycythemia vera, or PV, is a type of slow-growing blood cancer that causes your body to produce too many red blood cells. Often, people may have PV for many years without experiencing any symptoms, and it is usually discovered through a routine blood test for something else. If your doctor suspects that you have PV, they will likely begin with a physical examination, followed by a series of tests including blood tests, a bone marrow test, and a genetic test. These tests are important to confirm the diagnosis of PV and to rule out other similar blood diseases. Once diagnosed, your doctor will likely refer you to a hematologist, a doctor who specializes in treating blood diseases. This is an important step in managing and treating PV effectively. When you visit your doctor, it's a good idea to write down any questions you have about your condition. For example, you could ask about the cause of your condition, what tests you may need, and when you will find out about your results. It's also helpful to take notes about your symptoms and how long you've had them. This can help your doctor better understand your situation and provide the best care for you. During your exam, your doctor will check for signs of polycythemia vera. They may look for bleeding in your gums, check for redness in your skin, and press on your belly to check the size of your spleen or liver. Your doctor will also take your blood pressure, check your pulse, and perform a physical exam to better understand what's happening with your body. When checking for polycythemia vera, your doctor may order several blood tests to help with the diagnosis. The most common tests include 1. Complete blood count, CBC. This test measures your hemoglobin, hematocrit, and the number of blood cells you have. High numbers for these levels can be signs of PV. The CBC test only takes a few minutes and you can usually get the results in 1 to 2 days. 2. Blood smear. This test not only provides a blood cell count but also shows the shape of your blood cells. This can help your doctor determine if you have PV and how advanced it might be. The blood smear test is also quick, with results available in 1 to 2 days. 3. Erythropoietin level. Erythropoietin is a hormone that tells your bone marrow to produce new blood cells. A very low level of EPO can be another sign of PV. The EPO test involves a quick blood draw from your arm, and you can usually get the results in 2 to 3 days. The bone marrow, which is the spongy center part of your bones, is responsible for making your blood cells. If your doctor suspects you have polycythemia vera, they may recommend a bone marrow test. There are 2 types of bone marrow tests: aspiration, which uses a liquid bone marrow sample, and biopsy, which uses a solid bone marrow sample. These tests will show if your bone marrow is producing too many blood cells. Both tests can be done at the same time and usually last between 10 to 30 minutes. Your doctor will numb the area around either your breastbone or pelvic bone before using a needle to take the bone marrow sample. If you feel anxious about the test, your doctor can provide medicine to help keep you calm. You can expect to receive the results of the test within 3 to 4 days, although it may take longer in some cases. In most cases of polycythemia vera, there is a mutation in a gene called JAK2. Your doctor can diagnose this by taking a blood sample or a bone marrow sample through a biopsy to check for the JAK2 gene mutation. Typically, the results can be obtained within 4 to 6 days, but it may take longer depending on the specific laboratory. If you have been diagnosed with PV, your doctor will work with you to determine the most effective treatment and will monitor your health closely to prevent any complications in the future. Many individuals with PV are able to lead a normal life with proper care. By managing symptoms effectively, some may even experience complete resolution of their symptoms.